My name is Dr. Karen Ericson, and I'm a chiropractor and cranial sacral therapist here in New York City. My specialty is pediatric chiropractic as well as perinatal chiropractic. So, as a natural healthcare provider and chiropractor, my main goal is to help mothers and babies breastfeed as long as possible. The health benefits to babies are well known. There's an enormous amount of research showing that it increases IQ and even decreases cardiovascular disease later on in life, so many other positive benefits. But the health benefits to mothers is equally compelling, and more research is coming out that shows that it reduces cancer risk and cardiovascular risk as well. One of the things I love about this boost is that it will support babies regardless of which age they're at. So the really young babies might be on their back or their side. I like that this supports their neck, head, and spine so that everything is lined up. You don't have to use your arms and your muscles to hold the baby up. The baby can be here. You can also put your arm under and have your arm supported so that the baby can have skin-on-skin contact with you, and you can really feel like you're holding your baby, but you're not having to do the work. I like that the entire spine is aligned from the shoulders, the head, and then to the pelvis, so there's no torquing of the baby. Really good for the hips. And I like that you can use this with the baby on its back or facing you, kind of belly-to-belly position, which is really important, especially for very young babies. I like that in those early days, some babies have trouble latching properly. And you have this crying baby and a crying mother, and the mother's trying to hold her breast and get the baby positioned, and it's really complicated because you're using your muscles and you're trying to see what's going on. And I love that you could use this and hold the baby and then just focus on getting the latch right without having to struggle as much. Anything that reduces the struggle lets you breastfeed more happily and longer. Most mothers don't realize that they're going to tend to get a lot of shoulder, arm, even carpal tunnel is really common with new mothers. I like that this, and a lot of that comes from scooping the baby either under their tush or under their head and actually flexing the wrist for long periods of time. And as babies get bigger, it actually puts a lot more stress on the wrist. So I'd like that you can hook your thumb on this and avoid bending your wrist or just keep your arm completely away altogether, which I think can really help some of the tendinitis and carpal tunnel symptoms that we commonly see with new mothers. It's also really important to let the shoulders be equal, so there's not this kind of unevening, kind of hiking up a shoulder or hiking up one leg, which is also really important. A lot of people are always sort of like pushing up to kind of make their lap higher for the baby. So I like that this automatically does that. And so we see a lot of young mothers who are coming in with neck pain, shoulder pain. They're tending to round over looking at this beautiful baby, and their posture, they have such forward head positions. So sometimes even women will come in with headaches, and it's all related to the nursing. So when we can correct the posture of nursing, it makes a huge difference. And same goes for bottle feeding. We see a lot of issues with carpal tunnel, holding the bottle, people's hands going numb, all kinds of things that will happen because it's really a repetitive stress syndrome that we can avoid with something like this.